Healing Our Village presents
COVID Conversations.
Where does she get her information from? Do you watch TV with her? Or
all of these things that we
Learn
find
about
in
staying
African Americans increase your susceptibility to getting the virus, especially this more contagious
Determine the
Delta
facts.
Right now, in hospitals throughout the country, but most certainly in
Hear
the
from
South,
the community.
what happens if it's positive? So you do not want to take the risk.
you need to ask those questions.
What made you come?
Because I want to get vaccinated so me and my family won't have COVID.
Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change, and I'm coming to you today for a COVID conversation for your health, COVID conversations. 2 years, COVID-free, and 2 weeks ago, I got COVID. Now, the reason I got COVID is because I let my guard down. I stopped wearing my mask. I went to a medical meeting in Hilton Head, and I was around nothing but doctors. All of us had our vaccines. All of us were boosted, and I thought I was in a safe zone. But I am not. I'm here to tell you, there is no safe zone. So now I wear my mask again, 24/7, wherever I go out. I don't care. I'm using my mask. I know that I probably got one of the new variants, so that's why I wanted to come to you today to talk about the new variants. My course of COVID was similar to most people's. I started feeling sick on the Monday, and I got tested on Tuesday, and I was positive. And my symptoms were scratchy throat. I had some nasal congestion, stuffy nose. I had no shortness of breath, no cough to speak of, no headache. I'm so glad I didn't have a headache. A lot of people complain of all of those things. And actually, some people now are complaining of diarrhea as well. So it's more like a intestinal flu. But I didn't have that. What I had was body aches so bad I couldn't get out of the bed. So I laid in the bed for 4 days before I was able to actually get up and get around. I went to the doctor, and he actually prescribed one of the new antivirals, but because there was an accident at the pharmacy where the prescription was called into, a truck ran into the building, they shut the pharmacy down. And so I wasn't able to get my prescription. And the other pharmacies wouldn't fill it even though they saw it in the computer. So they told me to go get another prescription, and I tried to do that, and my doctor said he wouldn't prescribe it again. So anyway, that if you're going to use the antivirals, just let you know they have to be taken as soon as you get tested as positive, within the first 5 days of being sick. If you pass that 5-day mark, they don't work so well. I also want to tell you that these antivirals, there's two of them available on the market, that there are doctors who are reporting to me that they're getting breakthrough. So the patient takes the medicine for 5 days, and then 3 days later, their symptoms have come back, and they're positive again. So these antivirals, they do work for some people, and then they don't work for everybody. You need to know that. So let's talk about BA.4 and BA.5. Those were the two new variants that are here now in the United States. We had OMICRON, you heard of that one. And now these are sort of in the same, sort of the same origin, viral origin of OMICRON, BA.4 and BA.5. Highly contagious, and that's why it's spreading. It's rampant in certain states, like Florida is having a huge problem right now with COVID spikes. And that's a lot of it had to do with the fact that Florida did not get vaccinated, widely vaccinated. So in states where you didn't have a lot of people vaccinated, it allows these variants to mutate. I know I've been telling you that for the last year, that one of the reasons to get the vaccination is it decreases the ability of the virus to relearn your immune system and get more virulent and more contagious. So because these states don't have a high rate of vaccination, when these new variants come out, these new viruses that have mutations, those people are more susceptible. There's some thinking out there that if you've actually had COVID and then also got the vaccinations and booster, you have what they call a hybrid immunity. So you're at the higher immunity level than people that didn't get COVID and just took the vaccinations and boosters. See, I never had COVID. This was my first bout of COVID. So I didn't have that hybrid immunity that everybody was talking about. So I just wanted to let you know that, after 2 years, I thought I was, I had missed the problem. I thought my immune system was great. I took my shots, and I didn't think I could get it, but I got it. And let me tell you, you don't want to get it. And for those of you who have never taken any vaccinations and have gotten COVID multiple times, there's some new data coming out that this virus and these mutations to the virus can actually suppress your T cells to the point that the T cells stop working. So you do not want to catch COVID. So you have to be careful. You still need to do your hand washing. You still need to use your mask. You still need to avoid crowds. And for those who have not gotten any vaccinations, I think that you should get vaccinated. For those who haven't gotten their booster yet, I'm going to wait until the new vaccines come out and get those boosters, because the vaccines that are out there currently don't seem to work as well on the B.4 and the B.5. It seems like the vaccines are less effective on those variants. The issue is, folks, you don't know what you're going to be exposed to. You might get exposed to the very first one, the alpha. You don't know. So since the vaccinations are still free and you can still get them, I think that it's better than not to get them. That's still my opinion, especially as these new variants continue to come out. So I just wanted to get you out there and let you know that even I can get COVID. I got it. I didn't think I could, but I got it. And now I am being super, super safe and cautious. If I'm going to get on a plane, I have to go somewhere, unfortunately, this Tuesday, but I will be wearing my KN95 mask on that plane. You can believe it. All right. Thank you so much. Thank you for tuning in for this COVID conversation. Lifestyle Change provides community-based outreach, education, and comprehensive health screenings. Unlike other organizations, TLC provides ongoing follow-up and documentation of clinical outcomes. This much-needed follow-up ensures that participants with abnormal test results receive the much-needed care that they deserve. TLC provides exit interviews with licensed healthcare providers to evaluate screening results and review medication therapy. We have opened the Wellness Connections Elder Care and Diabetes Management Center located in Jonesboro, Georgia. Our address is 177 North Main Street. At the Wellness Center, we provide diabetes classes, home health care services, nutritional workshops, and even cooking demonstrations. TLC needs your generous support to bring our outreach program to your community. Your generous support makes it possible for Total Lifestyle Change to provide our educational workshops, our health fairs, our cooking demonstrations, and our church-based program to underserved communities nationwide. To donate to TLC, go to tlc-global.org. Please consider making a tax-deductible donation today in any amount that you would like. For more information, contact Dr. Lenore Coleman, President and Founder of Total Lifestyle Change, at drcoleman@healingourvillage.com. Thank you so much.